So the question asks, this clinical picture is seen in which poisoning? So this clinical picture shows raindrop pigmentation. So these are the raindrop pigmentation which is common on the trunk, which is seen with arsenic poisoning. So today we would be seeing features of arsenic poisoning, a very interesting and easy way to remember features of arsenic poisoning. I'm sure you would love it. So here we have a story which we have created on arsenic poisoning. So there's a hippie female named Marsh Rinch Gutsy. So she's a hippie female who likes to go out partying, eating out. So one day she decides to go out for dinner and she gets ready for the party. So she puts nail paint. This nail paint is like the Mies lines, the Aldrich Mies lines which are seen on nails in arsenic poisoning. She puts nail paint, she puts mehendi. The mehendi is like hyperkeratosis, which is again seen in arsenic poisoning. Then she wears the black footwear, so we see black foot disease in arsenic poisoning. Now she decides to go out for dinner. She's ready for the party. When she goes out, there is rain, so she gets raindrop pigmentation on the way because of the rainfall. So she gets raindrop pigmentation. Once she reaches the venue, she reaches the pub. She likes eating Chinese, so she orders garlic noodles. So the order is garlic order. Then we have desserts which are ordered by her. So she orders red velvet cake. So red velvet is the appearance of the stomach mucosa in arsenic poisoning. So garlic order, red velvet. Then she drinks water. Once you drink water outside which is contaminated, you get cholera. So she gets cholera. So the features in arsenic poisoning are like cholera. And her health deteriorates suddenly because of cholera. So to rescue her because of the heavy rainfall, we have fairy which comes to rescue her. So this fairy is actually ferric oxide, which is the antidote for arsenic poisoning. Now once you have arsenic, it goes and deposits in the liver the maximum. So we get yellow fatty liver. So yellow fatty liver is seen with arsenic poisoning, which then progresses to non-cirrhotic portal fibrosis. So non-cirrhotic portal fibrosis is seen with arsenic poisoning. So for acute poisoning, we will sample liver. Now with chronic ingestion of arsenic, finally she dies. What is the fatal dose? 100 to 200 milligram. So the fatal dose is 100 to 200 milligram. And once the patient dies, arsenic delays rigor mortis and putrefaction. So delay in putrefaction is seen with arsenic poisoning. And once the patient dies, if you want to know that it was because of arsenic poisoning, you will not take blood sample because arsenic clears from the blood very soon. You will not take liver sample, but you can sample bones, hair and nails. So remember the mummies, bones, hair and nails. So you can sample those after death for arsenic poisoning. So these are the features of arsenic poisoning, easy way to remember. Let's revise quickly. So a hippie female named Marsh Rinch Gutsy who likes to go out and partying. She gets ready for party. She puts the nail paint, those are the Mies lines. She puts the mehendi, that is hyperkeratosis. She wears the black footwear, that is black foot disease. When she goes to the venue, there is rainfall, so she gets raindrop pigmentation. In the restaurant, in the pub, she orders garlic noodles, that is garlic odor, red velvet mucosa. Then she drinks water, so she gets cholera. Then to rescue her, we have fairy, that is ferric oxide is antidote. Then you get yellow fatty liver where the arsenic deposits. So acute poisoning, you sample liver. Chronic poisoning or after death, you sample bones, hair and nails, that is the mummies. Fatal dose is 100 to 200 milligrams and it delays the putrefaction or rigor mortis. So important points about arsenic poisoning, very important for your exam.